Good day, everyone. I am Christina Yap, and we will be discussing about hypothyroidism. So, what is hypothyroidism? It is a condition in which by the thyroid gland is not able to produce enough thyroid hormone. So, since the main purpose of thyroid hormones is to run the body's metabolism, it is understandable that people or individuals with this condition will have symptoms associated with a slow metabolism. Further understanding about hypothyroidism is that it is a condition caused by the underactive thyroid gland, which is opposite with the hyperthyroidism, which is they it function as an overactive ability of a thyroid gland to produce an excess amount of thyroid hormones. So it can be treated with thyroid hormone replacement medication. It slows down a person's metabolism. It leads to weight gain and sluggishness. A syndrome of this condition results from deficiency of thyroid hormones and is manifested largely by a reversible slowing down of all body functions. So it occurs with or without thyroid enlargement, which is what we call the goiter. And for the laboratory diagnosis of hypothyroidism in the adult, it is easily made by the combination of low free thyroxine and elevated serum TSH level. So for thyroid secretes two types of hormones, or they secreted two types of hormones, which is the iodine-containing amino acids, which is thyroxine, and triiodothyronine, and a peptide, which we call the calcitonin. So for these two types of hormones, the thyroxine and triiodothyronine, they have a broad effects on growth, development, and metabolism of individuals. So for calcitonin, it is important in calcium metabolism, like for bones and other related functions. So how do we know that a person or a patient has hypothyroidism? So we have the area of patient's body that shows signs and symptoms. So we have on the top the psychological area. They produces a poor memory and concentration. The next one for the hearing function of the patient, they produces poor hearing, and in the pharynx area, it shows hoarseness, and in cardiovascular area in our heart, it slows down the pulse rate and pericardial effusion. For the muscular system, it delays the reflex of relaxation of muscles and going down to the extremities with coldness, carpal tunnel syndrome. And in general signs and symptoms of the patient's body, they showed fatigue, feeling cold, weight gain with poor appetite. And another one, we have hair loss. And in respiratory area for the lungs, they showed or they produces shortness of breath and pleural effusion. In integumentary area or in the skin, it showed paresthesia and mixed edema. In internal part of the patient, is specifically in intestines, it shows constipation and ascites. For reproductive system, we have menorrhagia. So the causes of hypothyroidism includes autoimmunity, sluggish liver, and estrogen dominance. We have the low stomach acid, the leaky gut syndrome, and adrenal fatigue.
So this is Salazar Tixi. I will be the next one to report about hypothyroidism. So there are two types of hypothyroidism. The first one is a central hypothyroidism. It is a rare and affects both sex equally and is more often associated with pituitary than hypothalamic disorder, but frequently involves both and is defined by low to normal TSH concentration and disproportionately low concentration of free thyroxine. So the second type of hypothyroidism is consumptive hypothyroidism. It is caused by aberrant expression of the deiodinase 3 enzyme, which inactivates thyroid hormone into tumor tissues. So we have here the clinical treatment. We have the corticoid, which has 72%, the propranolol, which has 31%, the interferon, 15%, vincristine, 25%, the spontaneous resolution, 6%, the cytosan, 3%, cyclophosphamide, 6%, radiotherapy, 3%. And in the surgical treatment, we have embolization, which is 6%, hepatic artery ligation, 6%, transplantation, 6%, and 6% for resection. So the thyroid contains two hormones, which are the L-thyroxine, which has tetraiodothyronine, or T4, and the L-triiodothyronine, which is the T3. Iodine is indispensable component of the thyroid hormones, comprising 65% of T4's weight and 58% of T3's. The thyroid hormones are the only iodine-containing compounds which, with established physiologic significance in vertebrates. So the etiology and pathogenesis of hypothyroidism. We have here the cause, Hashimoto's thyroiditis. Pathogenesis is the autoimmune destruction of thyroid. In the greater, it's present early, absent later. The degree of hypothyroidism is mild to severe. The drug induced, the pathogenesis is block hormone formation. In greater, it is present. The degree of hypothyroidism is mild to moderate. This monogenesis is impaired synthesis of T4 due to enzyme deficiency. In the greater it is present, degree of hypothyroidism is mild to severe. The radiation or the X-ray thyroidectomy. In the pathogenesis, the destruction of or removal of the gland. In the greater it's absent, and the degree of hypothyroidism is severe. In the cause of congenital or cretinism, atherosclerosis or ectopic thyroid iodine deficiency, TSH, receptor blocking antibodies, in the greater it is absent or present, the degree of hypothyroidism is severe. In the secondary TSH deficiency, pituitary or hypothalamic disease, in the greater it is absent, the degree of hypothyroidism is mild.
So for the last remaining topic, I am Jana Mary Baksarapa. I'm going to tackle about it. So synthesis of T4 and T3. So thyroxine or T4 and triiodothyronine T3 are produced from thyroid follicular cells within the thyroid gland, a process regulated by thyroid stimulating hormones secreted by the anterior pituitary gland. T3 is identical to T4, but it has one less iodine atom per molecule. So T3 and T4 are synthesized from both iodine and tyrosine. Regulation of T3 and T4. T3 and T4 production is regulated by thyroid stimulating hormone or TSH, secreted by pituitary gland, which is in return regulated by thyrotropin releasing hormone or TRH, secreted by the hypothalamus. This process works as a negative feedback loop. So roles of T3 and T4. Thyroxine or T4 and triiodothyronine T3 are important hormones produced by the thyroid gland that are essential for the brain and physical development in infants and for metabolic activity in adults. Thyroid hormones help the brain, heart, liver, muscles, and other organ function properly. So mechanism of action. Drug use and thyroid disease. So standard treatment for hypothyroidism involves daily use of synthetic thyroid hormone, which is the most common is levothyroxine. This medication restores adequate hormone levels, reversing the signs and symptoms of hypothyroidism. So levothyroxine sodium is also used to treat other types of thyroid hormone and thyroid disorders and conditions, such as certain types of goiters, thyroid cancer. Levothyroxine sodium should not be used to treat infertility unless it is caused by low thyroid hormone levels. Contraindication: hypersensitivity to thyroid hormone or other ingredients, acute myocardial infarction, thyrotoxicosis, untreated adrenal insufficiency. Synthetic thyroid hormone should not be used in the treatment of obesity or infertility. Avoid beta blocker use when patients are being treated for cardiovascular complication caused by levothyroxine abuse. So in the absorption of thyroxine, though dosage will also vary depending on age and weight. Infants and children require more T4 per kilogram of body weight than adults. Higher thyroxine requirements have also been reported in patients with celiac disease and Helicobacter pylori gastritis. Thyroxine doses may be lower following treatment. So that would be all, and thank you.